AJ, we're going to do an examination of your lower vascular system today. Okay? Sounds good. So the first thing I'm going to do is I'm going to just inspect everything from your inguinal ligament down to your toes. And I'm looking for skin discolorations, any patterns with hair that are not symmetrical or bilateral. I'm also looking at tissue changes, tissue volume, muscle tone, anything like that that would cause me to be concerned of anything. The hair patterns seem normal, skin looks like it's normally colored, and I don't see any problems with edema or swelling or tissue volume. So we'll move on, and the next thing I'm going to do is temperature. So I'm going to go down your legs by laterally, checking for temperature. So we're going to go down the middle, and those feel symmetrical. As far as temperature, here, temperature is the same side to side. Over here, okay. Temperature is same side to side too. The next part of this is I'm going to squeeze your nails, and I'm looking for the color to return. Okay. So what I'm doing is I'm just making sure that you have good blood flow to your feet. And I want to make sure that the redness comes back. Everything looks good so far. It's returning to its normal color. I'm just going to look for chronic venous stasis. So I'm looking at your ankles and your lower legs, looking for any venous patterns that look strange to me. I'm also going to look at your toenails, making sure that everything looks normal. There's no cuts or lesions in there. That looks great too. So the next part of this is, let's see, we're going to move into palpation now. So I'm going to do pitting edema, so I'll just go on the shin, and then on the dorsum of your foot, and then behind the ankle for the posterior tib, okay? So I'm just pushing down, and I'm making sure that the skin returns to its normal plumpness. It should, and if it doesn't, there's a scale for that through 1 to 4. So I'll go on this side now. Dorsum of the foot, shin bone, making sure that the skin returns as it should, and everything was great for that. So the next part of this is I'm looking for any skin thickening. If I see skin thickening, that would mean like drawing edema or brittleness. As far as palpation goes, I don't feel any of that edema, and I don't feel any of the brittleness either. Okay, I'm going to check your pulses now. So I'm going to do bilateral pulses. I'm checking the dorsal pedis artery, popliteal, femoral, and posterior tib. Okay. So I'm just going to find this one here. And I'm just going to go bilateral because it's easy for me to compare them. It's good. Posterior tibial artery is right here. And those are symmetrical too. They're both strong rhythms, which is what we want to see. Great. And popliteal, right here on the side view. Look for those popliteal arteries. And then I'll do the femoral one, but I want you to find your pubic symphysis first. Okay. So just your bone right there. Right there. Keep your fingers on that for me. And I go between that and ASIS with my thumb, and I'm on the femoral artery. And I can feel the pulse, it's strong. That's regular rhythm. I can go from the other side, pubic symphysis again, in between. And there should be a femoral artery. That's good. So the next part of this is I'm going to do auscultation of that femoral artery again. So I'll have you find your pubic symphysis again. And then I'm going to go right here, and I want you to go and take this, the earpiece, put it on your femoral artery, skin to skin for me. And I'm just going to listen to make sure there's no grooves in there. So I want you to keep your hand on your pubic symphysis, and right here underneath there, you'll feel a pulse. Okay. And when you find it, I'd like you to put this on there on the diaphragm side. Good. That was normal, so I'll have you go on your left side. So I'll go around for you. All right, same thing. When you find your artery, just go ahead and put it. There you go. Both sides have a strong blood regular rhythm, which is what we want to see. I'm going to do a few special tests now. So what we're going to do is a hernia test. I'm going to be looking around the femoral area, the inguinal ligament, for a femoral hernia. Okay. So what I want you to do is find your pubic symphysis. Once again, right there. Yep. And I'm just going to put my fingers. If I put my middle finger between the ASIS, the pubic symphysis, and that line, it should be on the artery, and then I'm on the vein next to that, and just medial to the vein, be the lymph node, and then medial to that, I'll be on the inguinal canal. Okay. So I want you to turn your head to the side and just cough for me. Okay. Good. Thank you. And I didn't feel anything protrude when you coughed, which is what we're going to see. So the next thing I'm going to do is the leg elevation test. I'm going to lift your legs up to 60 degrees so that the color fades from your lower legs. And after 60 seconds, I'm going to lower it and make sure the blood returns. Okay. When I do lower it, I want you to sit on the edge of the bench with your feet on the ground. Okay. So this will take 60 seconds. And we're just going to sit here and let the blood leave the lower extremities. I can also feel your posterior tibial pulse from here. I can feel it weakens a little bit as we go, which is what we want to see. Okay. After 60 seconds, I'll just have you sit on the edge of the bench. And after 15 seconds, the color should return. And that's what we're seeing. And it does go from the dorsal side of the foot into the toes within 15 seconds, which is what we like to see. The next thing I'm going to do is have you lay back down. Okay. And I'm going to do a test looking for a Hohmann sign. So I'm going to lift your leg up. I'm going to squeeze your calf and dorsiflex, okay? Just going to push this way. Do you have any pain there? No. Okay, good. If this test was positive, there would be pain in the calf muscle, okay? And the last thing I'm going to do is have you stand up and face that window for me. Awesome. And I'm going to go to the femoral saphenous junction, and I'm going to tap right here, okay? And if this test is positive, I will feel pulsations, and if not, it's a negative test, which is what we want. So I'm just going to tap right here, the junction, and I'm checking the valves of the great saphenous vein. Good. I'll check this one too. Again, if I felt those pulsations, that would be a positive test indicating incompetence of those great saphenous vein valves, and those are negative. So thank you very much for coming in.
Thank you.